again, this is data collection and interpretation 101. It's not going to go in great detail, but just to kind of give you an overview of data collection and interpretation. So let's first start with frameworks and definitions. When we think of data collection, oftentimes it's for an assessment. Just a second. I am having a hard time with my screen. Apologize. There we go. I'm sorry, the view was obscuring my notes. Is to get a pulse on our population. So what does that mean? The first word in the definition, I think, is the most important word, and it's systematic. Assessment has to be done systematically. It's a systematic gathering, review, and use of information in order to develop a deeper understanding of a population or of an issue. So you're given a problem, which may or may not be a problem. You don't know until you collect data. So how do you know it's a problem? Like I said, you collect data. Where do you even start? Is there a problem, or the problem may not be what you think it is? So in order to get more understanding of it, you start an assessment. The first thing I advise before doing an assessment is to look at the research. Has a needs assessment like this been done before? I like to really take it step by step, piece by piece, take a big problem and break it down. Like I said, has it been done before? What seemed to work? What didn't seem to work? I consult literature, and a lot of times you'll find that you don't need to reinvent the wheel. And that's very important because you want to use strategies that have been tested before and receive some feedback if possible, maybe even evaluated. It's a good thing to consult the literature to see what's already out there. So let's talk about the different types of needs assessments and their purposes. The first, needs assessment. Who needs intervention and services? And how great is the need? What can be done to meet the need? It's important that as you gather some of the answers that you are flexible, because your needs assessment may determine that you need to ask more questions. Be very flexible, be willing to reevaluate and reassess as you go. There's also a resource assessment. Just as important is what resources, things like staff, funding, skills, technology, infrastructure that you have. You may have one need, but you just don't have the resources to support that need. You also want to identify what is lacking and what you can do to address what's lacking. Are you going to be able to rectify that for your need? Or maybe the needs assessment determines you should focus on resources for now. There's also a readiness assessment. What's the current status of the community and organizational awareness, effort, climate, and leadership? Another thing I want to throw in is political will. You may have the need for it and you may have the resources, but the readiness just doesn't exist, or the political will doesn't exist. I've encountered this actually, excuse me. Community had done a needs assessment, identified their need, but the community and the political will just wasn't there to address it. So they had to go back and reassess. So why is assessment important? Strategic planning. An assessment can give important information that will aid in strategic planning. You can create a plan on how you will address your findings. Gap analysis. You may find a lot of gaps in your assessment. This happened to me with the needs assessment I did when I was at another agency. And it actually ended up being a very good thing. So don't be discouraged if you find a lot of gaps. They can be great opportunities. By addressing these gaps, you have the opportunity to create an infrastructure to help with future planning. So what we did to address some of the gaps is we put some things into place that served us throughout the years, and we really created a great infrastructure. So it ended up being a good thing finding those gaps. Targeting limited resources. We know how limited resources can be, so it's important to target them strategically, which an assessment can help do. And also justifying need for resources. You want to have justification when you seek resources, and an assessment is a tool for that. I've had experience a couple of times where resources were limited and an assessment was absolutely invaluable. Way back a long time ago, I'm not going to tell you how many years ago, when I worked at the state health department, the governor had an initiative to reduce infant mortality, and we had very limited resources. We had certain areas that had very high rates of infant mortality, and other areas that had very high numbers of infant mortality. And we're going to talk about the difference in that later and why it's important to investigate both. In this case, it was really important to see that even though the rate was high, our limited resources may have only impacted a couple children, since rates are dependent on populations. Whereas if we looked at the numbers that had a lower rate, our needs assessment showed that we target our resources there, we could impact more numbers. A similar situation happened when I was at the Department of Mental Health and Substance Abuse Services. Again, a long time ago, before naloxone was kind of, standard issue. All first responders weren't equipped with it. And we decided to pilot a program, and we were going to evaluate it. We had an area, and I'm going to talk about this later, that had a very high rate, but very low numbers, compared to an area that had a pretty high rate, but higher numbers. And so we went to target our resources in the area with higher numbers. But again, it's important to look at both, and we'll talk about that a little later, how getting all that information to create a picture independent on what you're looking for and how you can look at things. Can also help apply for funding. As you all are probably aware, that needs assessments can show needs, and all of a sudden, well, you might be doing the needs assessment for federal funding, or you do the needs assessment and then you search for some federal funding. So it's great to have that. And you can also use it to create RFPs. So let's talk about different types of data and why they're important. You have evidence in your needs assessment, you'll collect data, and this will give you evidence versus just speculation. Communities a lot of times have hot topics, or there's a lot of talk around a local problem. I've seen this before in a community where the newspaper gets a hold of a story and the community says, this is a problem, we have to address it. Well, you can investigate that, but you don't know for sure if it's really a problem until you have data to support it, or if it's just someone was famous in the newspaper. Sometimes it's true and it's really a problem, and sometimes it's not true. I've also had a community that didn't use data and implemented a program, and that wasn't the problem in their community. And it was really sad because they had the opportunity for funding to address an issue, and they wasted the resource on an issue that didn't exist. So when you do a needs assessment, you may get two types of data: quantitative data and qualitative data. Quantitative data is information that can be counted or expressed numerically, and that's probably what most people are comfortable with. It can be, or at least comfortable with seeing. It can be analyzed using statistical methods, and the results are usually generalizable. They can be displayed in tables, charts, and graphs. They're presented in numbers, rates, and ratios, and percentages. And then there's also qualitative data, and those are words rather than numbers. And those can be tricky to evaluate, but they're important. Excuse me. They're systematically collected through interviews, observations, or focus groups. And the results aren't generalizable because you're not taking a sample of a population. You're just taking a few people for a focus group or key informant interviews. So you can extrapolate that back to your entire population, but that information is very important, and we'll talk about it a little bit later. Analysis involves identification of patterns and adds context to your quantitative data. Qualitative data can also lead you to where and how to collect quantitative data. For example, you can learn insight from a key informant interview. You need to know if this is systematic or just from one or two individuals. So you can incorporate a question onto a survey regarding the information you've learned, and then administer that survey to a larger audience. Similarly, you can also reverse that. There's a technique that I've used in the past when I'm doing surveys on adolescents pertaining to drug use. And what I'll do is I'll list the common drugs, and then I'll have a write-in question that says other. Now, that would be considered qualitative data. And so if a certain drug reaches a 5% or more threshold, I'll know to incorporate it as a standard answer the next time we do the survey. And it also helps kind of keep a pulse on what's going on in the community. Primary data. So when you're doing your needs assessment, you'll come across primary data and secondary data. These are just two types of data that you can collect, and I'll tell you the difference between them. Primary data are collected through news surveys, interviews, observations, information that's collected firsthand. These data are unique to the research that you're doing. Your primary data will apply to your project. Collection methods include surveys, questionnaires, interviews, focus groups, observations, case studies, diaries, critical incidents, etc. Primary data collection can be time-consuming and can be expensive, but as we'll talk later, sometimes it's absolutely necessary. And then we have secondary data. And those are data that already exist. Primary data collection can be expensive. So it's nice when you have secondary data. It's less expensive. And with secondary data, we're going to talk a little later. I know I keep saying we'll talk a little later, but we will, about something called the gold standard. A lot of secondary data have been vetted already, and some meet a gold standard of data collection. So that's always good when they've been researched, peer-reviewed, and tested on focus groups. They've already been collected by someone else. They may also have data on a level that's not provided publicly, so you may need to get a data user agreement to obtain it. I know a lot of national data sets, and sometimes it's really hard to find the data you need from a national data set, and there are kind of backdoor ways to query that. But sometimes they have the data that you may need, they just don't publish it. So you may need a data user agreement. And there's usually, I've contacted the CDC about some of their studies. I've contacted NESDA about some of their data. So they usually have pretty easily obtainable contact information where you can email them or call them and then discuss a data user agreement to see if they have data that fits your needs. Okay, so are we ready for the first quiz? Again, moderators, if you can help me, it'll be the first person in chat to answer the question correctly, and we'll keep track of that for the gift card. And I put my email address there, so if you're the winner, if you would email me your name, your mailing address, and I will get you your card, your $20 Walmart gift card.
Jamie, just to let you know, you're not quite sharing your screen fully, so we can actually see the answer, unfortunately.
No! You can see the answer?
Yes, so we're able to see your next slide.
Really?
Hey, Jamie, so if you go up to display settings at the very top of the presenter mode, you can switch screens.
Oh.
You can swap presenter mode and slideshow.
I did not know this. I apologize. Well, now I just have, I don't want to do what I just did. Let's see.
So right now we can see the slide and not your notes. So you fixed it.
So you've seen my notes the whole time? Oh my goodness, I apologize. How do I change it back to that? I'm not seeing. Try that again. Okay, you can't see it, can you?
No, we can't. We can just see the slide.
Okay, good. Thank you very much. I had no idea. It looked great from my end. Okay, so let me look in the chat. This is the first word in the definition that was given for assessment. I also mentioned that I think it to be the most important word. Shelby Betsy, is that what you all have, moderators?
That's what we'd have.
Good job, good job. Okay, with this type of data, you can analyze it using statistical methods. So it's the type of data I discussed. There were, yeah, hey, is that Lisa
Looks like
Harrington?
Lisa. Yep.
These type of data already exist. When you're doing a needs assessment, you may have to collect some of your, okay, whoa, 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 whoa. A lot of people knew that one. Alexis, is that who you all have?
That's what we got.
This type of assessment measures current status of things like community and organizational awareness. It's type of assessment. When I discuss the different types of assessment, justifying needs for resources, qualitative. So there are different types of assessments. Guys are around it. There's a needs assessment, yes. This one, this type of assessment measures the current status of things like community and organizational awareness. Resources close. Readiness, yay, who did it? Shelby, all right. Shelby, you named, that's awesome, you named 3 of them. Okay, we discussed 6 reasons why needs assessments are important. Can you name 2 of them? Target planning and gaps analysis. Yep. Is that Shelby again?
Looks like Shelby again.
Right, Shelby. Okay, so let's look. So I have Shelby with 3, and then Alexis and Lisa each with 1.
Looks about right.
Okay. Okay, Shelby, if you want to email me with your name and mailing address, I'll get you a Walmart gift card. Thank you all very much for participating. Okay, let me. One more minute. Not a minute. For some reason, all I'm seeing is my slides. So fortunately, I printed out some notes, so I'll go by those. Let's talk about secondary data. Remember, we talked a little bit about primary data, or I told you what primary data and secondary data were. Now let's go into a little bit into secondary data. Secondary data are from national data sources. Well, gold standard secondary data, I should say. When I think about gold standards of data, these are things that I look for. They're publicly available. They're usually from a national standard. The measurable is available from a centralized, like I said, national data source. They're also made available at the state level. It's available and aggregated at a lower geographic level. It meets a test of validity. It's research-based, evidenced by data collected accurately measuring the specific construct and yields a true snapshot of the phenomenon at the time of the assessment. The measure should be available for the past 3 to 5 years. So you want to be able, and we'll talk about time trends later. I keep saying we'll talk about things later, and it's because these concepts are all interrelated. So when you're looking at data sources, the gold standard type data sources, you want to make sure that they have a history of the same question being asked the same way over a certain period of time. The means of collecting data and organizing data should be relatively unchanged over time. Sometimes they'll do a little revision to the questions or a little revision to the way that they do the sampling, but it's usually relatively the same over the time. You don't want them asking different questions from year to year, so you're not getting trend. So those are gold standards that I look for when I am looking for existing data sources. The problem is that gold standard data sources may not exist on a level that you need them at your community level. You may find an amazing national gold standard data source, but it's not geographically appropriate and it's not racially appropriate. So here are some gold standard data sources that you can find online. These are from SAMHSA, the Substance Abuse and Mental Health Services Administration. The first one, I don't know if you're aware of, the National Survey on Drug Use and Health called NESDA. It's really a great survey in that it has youth from 12 all the way to adults and asks mental health and substance abuse questions. The BRFA survey, which you may be familiar with on the YRBS, I think it's on the next slide. It asks some substance abuse questions, not a lot of mental health, but SAMHSA is designed specifically for substance abuse and mental health. The problem is American Indian data. Now, they did do a report a couple years ago on American Indian data, and I hope that they'll do more of those. They do have a way that you can go in and kind of backdoor query some of their data that where you might find what you're looking for. Then also from SAMHSA, we have TEDS, treatment episodic data, and that's treatment data. And if you're in Oklahoma, the Department of Mental Health and Substance Abuse, that's more of a local, it's not a national, but they have treatment data as well that may assist you in your needs assessment. But for national data, it's TEDS. And then there's also monitoring the future. And that's a prevention needs assessment survey. And the form of this that you've probably have seen is called the Oklahoma Prevention Needs Assessment Survey. In most states, I'm trying to think of if I've ever found a state that doesn't have a prevention needs assessment survey, and I don't know that I have. What they've done is SAMHSA bought the rights to the Monitoring the Future survey, and so it allows states to implement their own form of that Monitoring the Future, which is they typically call a prevention needs assessment survey. And here in Oklahoma, we call the Oklahoma Prevention Needs Assessment Survey. Then we have some additional gold standard, those national secondary databases. We have Behavioral Risk Factor Surveillance Survey. Also, we have our version of that to get more kind of as a primary data collection. We have the tribal BRFIS, so that we've taken the BRFIS and kind of catered it to our community's needs. Then you also have from the CDC, the Youth Risk Behavior Survey, the YRBS. You may be familiar with that. Sometimes you can get good American Indian data on it. Cherokee Nation used to pay for an oversampling of that. I'm not sure if they still do or not. Then you have, this is the database I use the most, this mortality data from CDC Wonder. It takes mortality data from all of the states and centralizes it. It can be a little tricky. It took me a while to learn. So I would recommend if you're going to use that database, you talk with someone who's familiar with it, or you can always reach out to us for help because it is, you query the data by ICD-10 codes. And so sometimes if you're looking for a certain indicator, a lot of ICD-10 codes go into that specific indicator. And if you're just one off, your data will be a little skewed. Also knowing the gold standard, or not the gold standard, I guess, the gold standard case definition. So I'll give you an example. When opioid mortality, way back a long time ago in 2009, before it was kind of standardized, people were using different ICD-10 codes and listing, you know, their state numbers for opioid overdose mortality. Well, the Council of State and Territorial Epidemiologists came together and developed kind of a gold standard case definition for what an opioid, a prescription opioid overdose was, which ICD-10 codes to include. Because what you had is different states using different codes and you're kind of comparing apples to oranges. You also have alcohol-related disease impact, it's called ARDI, and smoking attributable mortality and morbidity costs, SAMIC. And then you have, I'm not as familiar with, well, I used to use ARDI. back in the day. More familiar with pregnancy risk assessment monitoring system, PRAMS. They also will put out some PRAMsgrams sometimes with some where they dive deeper into the research, but that's a database that's queryable through the CDC as well. So let's talk about some other national data sources. The National Highway Traffic Safety Administration puts out a report called FARS, and I really like this data source. You can go in and you can query fatal alcohol accidents involving alcohol. What they do, I think this is interesting. I didn't know this when I was initially querying the data, is they take case reports, but then they will also use a logarithm to assign based on the road, the time of day, and other things, and they'll put it into a logarithm, and then what they assign what they think, well, not what they think, it's actually, you know, statistically based with an alcohol related accident, and they align that with the reports they're getting. Then another really good database is the Uniform Crime Reports, and those, like I said, with FARS and with UCR, I use those both for reporting for SAMHSA. If any of you have SAMHSA grants, you may be familiar with that. Then there's also the Census Bureau. So when you're doing your needs assessment, you'll probably need to get information on population, poverty, or income, I should say, education, household size, things like that. And the Census Bureau is really great for that. Their website, depending on what you want, can be a little tricky sometimes, but it's because it has so much information to go through. And then there's the Kaiser Family Foundation, and then the Annie E. Casey Foundation Kids Count Data Center. And there are more. These are just a few that I wanted to give for examples. You may know about the National Outcomes Measures. It's for SAMHSA. It's designed to provide meaningful real-life outcomes for people striving to attain a sustained recovery, build resilience to work, learn, live, and participate fully in their communities. So sometimes when you have a grant from SAMHSA, you'll be expected to report on some of these indicators. And subsequently, you can also go into SAMHSA and look at those indicators to see what your state reported. Here are the domains covered in NAHMS: reduce mortality and morbidity, employment and education, crime and criminal justice. Like I said, you know, the UCR data for crime, social connectedness, access capacity, retention, and cost effectiveness. And what you may also find when you go into the NAHMS data, you can find the indicators that they use to report those things, and then you can look at those sources of data and possibly find it on your community level. Then also, if you're doing a federal grant, sometimes through the CDC, you report into GIPRA. I don't know if you're familiar or not, but it is required reporting, like I said. It measures a few sets of things like substance abuse, attitudes and beliefs, state and local data sources. Again, there are a lot of limitations. It's very important to understand how each of those data are collected. But if you go in there, you may find that some of those indicators reported are relative to what you need for your needs assessment, or the sources have a lower level of racial or geographic data that you can use. State and local data sources. Those are things like your state, county, local health departments. Us, well, we don't, we can get a lot of different data, and we get national data as well. Education, public safety. I've used data from schools, corrections departments, transportation. Another source of data that we use a lot are hospitals, emergency room data, discharge data from hospital visits. The thing about that you need to be careful, and clinic data, you may have your local clinic data. If you're wanting to look at different types of data from different hospitals or clinics, make sure you know how they're collected, because the problem is not all data are collected equally. And that goes for the same with like law enforcement data. You know, the Uniform Crime Report is a uniform report, but if you're looking at different types of law enforcement data, you need to look at how those data are collected. And if you're using different sources for comparison, see that they're collected in the same way, because they may not be. There are also the tribal and state epidemiological profiles. A lot of states have epidemiological profiles. Oklahoma did a really neat thing, and they combined their tribal epidemiological outcomes work group with their state epidemiological outcomes work groups. And so what they have is they have these profiles that for the tribe and for the state on indicators. Now they are more centered around indicators pertaining to mental health and substance abuse, but the data sources that the people bring to the table may have indicators that are relevant to other things that may be helpful. So if you haven't attended one of those meetings, they meet quarterly. You can reach out to me, my email, if you're interested in attending those. I think they're really helpful. Okay, so now it's quiz 2. Let me pull up the chat so I can see. So if the existing data aren't culturally, geographically appropriate, this is one reason that you should potentially, if you want to get better data, because the secondary data may not represent you on a geographic level or on a racial level. Gold standard. So say that I look at, I'll give you an example. Say I go to the BRFIS, and the BRFIS just doesn't represent my community. So I might try to do the BRFIS on a local level. Other data sources. Okay, Be More, okay. I'll go with Be More. Be More, yeah, we're gonna look at primary data collection. If you're finding, so like an example was with the BRFIS, excuse me, we adapted the BRFIS to represent our communities and do the tribal BRFIS. So it's taking maybe a national source, that gold standard, you can't get it on the level that you need it. So you may want to do your own survey. You may look at primary data collection for that. Oh, you know what? Let me. Sorry. I'm sorry, I'm trying to find my other question without my notes. So what can someone name one of the issues when you're comparing two data sources? I kind of talked about, yes, Census Bureau may provide geographical. That's very good, Sandra, may provide geographical information. So when you're looking at different data sources, what's one of the things that you need to be aware of? I talked about this. Yes, exactly, Lisa. The quality of collection may differ. Exactly. So when we talked about this, substance abuse and mental health services you're required when you have a grant from them to report to this. And these data are collected, and it's called it starts with an N. Samet close. NOMS, there's Tracy, yes. Very good. Okay, we'll do, how about one more? The database that's used, national gold standard from the CDC, that's used to collect mortality data. Burfus is a close. CDC Wonder. Yep, CDC Wonder. Whomever said CDC Wonder. Alejandra. So moderators, did we have a winner? Do I need to ask another question?
It doesn't look like there's a clear winner, so maybe one more question.
Okay. So when these data are reported to the CDC when you have a grant, and they're collected by the CDC, and they're starts with a G. Oh, GRPRA. Very good, GRPRA. I think Bob gets that one. And okay, I'll ask one more. I don't think we have a winner yet, do we?
It looks like B Moore has 2.
Be more? Okay.
Yeah.
Okay. Be more. If you will email me, I put my email there. If you will email me, I will get you your gift card with your name and your mailing address, please. Okay. Thank you all for participating. I really appreciate that. You guys are learning. I was really surprised at some of the terms that you were able to recall. That's wonderful. So let's talk about primary data collection. So when existing data sources don't exist, like I talked about, those gold standards of data, sometimes we have to collect our own data. And one of the things that we can do is do a survey. And why do we do a survey? Information for planning doesn't exist, or like I said, it can exist, but it's not culturally or geographically appropriate. And that's one of the reasons, like I said, why we've adapted for the tribal Burfus. Another local prevention survey, although it's based on the National Monitoring the Future, is the Oklahoma Prevention Needs Assessment Survey. And they do a separate American Indian report. So that's a really good survey. And I highly recommend participation in that in our tribal Burfus, because the more people who participate, the better data that we have and the better data the communities have. Also, why do a survey? A large geographic area needs to be covered. And also there's need for consistency in items. So let's talk about ways that you can administer a survey. Of course, there's a personal interview face-to-face. But in the time of COVID, this may not be as viable. It may also be time-consuming and expensive. There are also telephone interviews, which can also be expensive. Telephone interviews, the expensive part of those, of course, is for the staff. But as I learned when we developed our own telephone survey when I was at another agency, obtaining those phone lists can be expensive. And then if you want to obtain a cellular phone list, it gets even more expensive. There's also self-administered questionnaires, in person, through mail, or online. This is the most common in my experience. It's the best and easiest, in my opinion, because you can do, multiple people can take it at the same time. You don't have to have one person who's actually going out and conducting interviews. So there are a lot of web-based survey technologies. I think most people probably have heard of SurveyMonkey. You can also combine different surveys and different modes of administration. You can do some face-to-face, some you can telephone sample. I know Nesta, I believe a long time ago, I don't know if they still sample this way. They used to go out in the field and do face-to-face interviews, and then they'd also do some other ways of sampling with their data or administering their survey. So the advantages of a personal interview: you get high cooperation and low refusal rates. It's a lot harder to tell someone no to their face. It's easier to ignore the phone or not answer an email or not go to the link that you provide them. So there's usually higher cooperation and lower refusal rates. And you can also ask longer questions, and people are more likely to respond rather, instead of having to write an essay or just hanging up the phone on you. They're just more likely to respond when you can ask longer questions for them. And that's really taking advantage of the interviewer being present for that. And the participant can also ask clarifying questions. The interviewer can read body language, and it just makes it a lot easier to capture complex answers to the questions. So those are some of the advantages, but there are also disadvantages. It can be costly, and it takes a longer time than other methods. You can imagine it would cost a lot of money if you needed to survey, say, for example, 200 people, and you have to interview every single person and travel geographically to those areas. And there can also be interview bias. So like I said earlier, a lot of times I've seen on surveys is people ask clarifying questions. If you have different interviewers answering that differently, you can introduce bias. You can also introduce bias just by the way you answer. One of the things that we were taught a long time ago when I used to do school-based surveys is, what does that mean to you? What does that mean to you? Instead of introducing what it means to me. So I didn't introduce bias. It may not be good for collecting sensitive information. A lot of times people might not feel comfortable divulging sensitive information in person, where they feel much more comfortable doing that through a paper survey or an online survey. Unless you have a really good interviewer that's really open-minded, and it's a skill. But again, most people don't want to divulge that kind of information face-to-face. And then we have a telephone interview. And there are advantages to that. It's less expensive than personal interviews, but like I said, it can be costly to obtain phone number lists, and especially costly if you obtain a cell number list additionally. It is faster than personal interviews, and you can cover a large geographic area because you're not actually having to go to people's houses and meet people face to face. You're still employing someone to administer the survey, so it's individual to individual again, and it can be a little costly, but people are more willing to answer when it's on paper than when it's in the face. And when I say you're employing people, I mean, you may employ one person to survey, say a class, for example, of 20 to 30 students instead of 1-to-1. So it's less costly in that way. There are also some disadvantages. I guess I talked a little bit about that with cost. It's not as costly as in person, but it's still more costly than, say, an online survey or a paper survey. So with a telephone survey, you're going to miss homes without, if their phone number isn't listed, or if you didn't pay additional money to obtain the cell. A lot of people no longer have landlines, and so you'll only be interviewing people that may have a landline if you don't get those cell phone numbers. And that may bias your survey as well, because the people who are more likely to have a landline versus the people who have a cell line. It's also easier to build rapport when you're interviewing someone face to face. So here's some advantages of a self-administered survey. And I think this is the most common way to administer a survey. It's generally low cost. There are no field interviews needed. And I think because it's low cost, less travel, I think it's why it's the most common. You don't need someone going out interviewing. You don't need to make phone calls. They can be handed out. They can be administered online. And the really nice thing about administering surveys online is that you don't have to enter all the data. I've had to do this before, and it's really nice when the data are already entered for you. I've had, surveys with thousands where I'm just sitting there, put in the headphones and just tap numbers. And, it also reduces error if you're not having to administer or enter the data yourself. And it's good for sensitive information because it seems the most anonymous way. Although all surveys are and should be anonymous, this one, the participant feels that they have more anonymity. So there are some important issues to consider when doing a survey. And it's, do you have the appropriate resources? What are your objectives? Who's your target population? And another thing is how you'll sample. They're all important issues to consider when you're developing your survey. And what I've found in the past is people just want to jump in and write a survey without planning, because they know what they want. They know what they want to hear. They're really excited to get started, and they don't put the time on the front end with the planning. And it's really important to do so. You need to really figure out what you're trying to answer, what your objectives are, what your target population is, and how you're going to sample that population so that you can get a representation of the population of interest. Okay, now I think we'll take a 10-minute break. They say attention span is 8 minutes, and I've gone over 8 minutes, but we can't take a break every 8 minutes. So let's take a 10-minute break and come back here at 11 o'clock. I hope everyone made it back and had a good break, got some water, fed the cat, which I fed my cat earlier, but I think he wants more. So now let's talk about what makes a good survey questions. I talked about surveys. We talked about when you might have to administer some of your own, which is called primary data collection. And I'm just wondering if maybe some of you have administered some surveys before, or maybe you've used some surveys and adapted them. What I found in developing surveys is usually there's a question out there that exists that measures what you're trying to measure. And it's a question usually from a gold standard survey. It's been given to a focus group, it's been researched, it's been vetted. And so you don't need to reinvent the wheel. You'll just can take a question from an already existing survey and use it for your needs. So things like YRBS, NESDA, BRFIS, they're under public domain, so you can use them. And they've been tested extensively. They've been around forever, and they know that the person reading it is answering what they're asking, hopefully. I've had some experience in the past where I've developed survey questions or I've read survey questions that the reader wasn't interpreting it the same way that it was asked. And that's why it's really good that if you have to develop a question, that you use a focus group. And if you can, by any means, just use an existing survey. And you may have to take questions from different surveys, or you may be able to take one survey and modify it to your needs. I'll give you an example. A long time ago, a colleague of mine, was writing a survey, and one of the questions, it was asking about parental attitudes on underage drinking. And one of the questions asked about, does your child, and then it went on, and my question was, well, which child? So you just want to make sure that the person interpreting it is interpreting it the way that you've intended. And I found that there's a lot of room for error on that. Surveys, there are whole courses developed to writing surveys. When I've developed surveys in the past, it's taken, and this was a big statewide survey that was, intended to be coupled with a national survey. And so we had a lot of time for planning, but I had people from all different backgrounds, all different disciplines. And it took us about a year to come up with really good survey questions. So, and then after that, you want to, like I said, give it to a focus group to make sure that they're interpreting it the same way that you're asking it, or that they're giving you the answer that is addressing the question you've intended. So it's hard. It's a very good skill set. And like I said, there are whole classes devoted to it, courses devoted to it, actually. So what are some of the things to develop a good survey question? like I said, there are usually gold standards that exist. So if you can use those, use those. And you can, like I said, even borrow from a different one. So it's best not to reinvent the wheel, but if you have to. So a good survey measures the underlying concepts it's intending to measure. Make sure you plan to know what you want to ask about. You want to avoid jargon, technical terms and jargon. You want to avoid vague questions, complex questions. You want to avoid double-barreled questions. Sometimes I've seen questions that will ask 2 questions in one, like, is there a problem with substance abuse or like opioid abuse and alcohol in your community? Well, that's 2 questions. You've asked about opioid use and you've asked about alcohol. So you just want to make sure that you're asking one question. And also avoid double negatives. Try not to use no and not in the same question because it can confuse the participant. So what are some things to develop good questions? So here are just a few tips. Again, you can find a lot of resources on this. And if you need additional resources, you can always reach out to us and we can help you with that. You want to avoid, like I said, oh, sorry. Good question. Sorry, I'm doing 2 different slides here. You want to include reference frames. You want to include reference frames for respondents. So one of the things that I see, sorry, I had everything on silent and it's not silencing. One of the things that I see is they'll ask, do you smoke cigarettes, or are you a current smoker or a previous smoker? So someone who quit smoking 20 years ago is very different than someone who is a current smoker. And so a lot of times in surveys, you'll see them ask how many cigarettes you smoked in a certain time frame, because it's really important to give those time frames because they mean something different. You want all possible response options. So it's important to think about the question and think about all the different ways a person may respond. And we're going to talk about some key informant interviews later in some focus groups, and these may help write responses to your surveys. You want responses that are mutually exclusive. So you don't want them to overlap. Say if you're giving an age scale, you don't want to have 18 to 25 and then 20 to 30 as an option. You want to make those options mutually exclusive. You also want to have balanced response scales. So for example, sometimes you'll see like a 4-tiered scale or a 5-tiered scale. One of the surveys I was analyzing once had 5 options. And those 5 options, there wasn't a neutral. There were 3 that were actually positive. The answers were excellent, very good, good, poor, and very poor. So we had 3 positives and 2 negatives. So I was analyzing the data and there are 3 positives and 2 negatives. So what we ended up, there wasn't a neutral. So what we ended up doing was adding a neutral of fair. So if you use a 5-point scale, you want to have a neutral, 2 negatives, a positive, and a neutral. If you use a 4-point scale, you don't need to have a neutral. But sometimes it's good to have a neutral. You want people to answer, but sometimes you want them to say good or bad, but sometimes it's important that there is a neutral in there. The same thing I kind of relate to that is also having an I don't know option. Like I said, you want people to answer it. And if they really don't know, they might choose not to answer the question. But you also don't want to give them the option just to put I don't know for everything. So you really need to look at what types of questions need I don't know and what types of questions don't. An example might be if it's something, say you're asking, I just actually got a survey last night from my city that I live in, and it asked me about some of the services and rating those services. Well, I don't use all of those services, so I had the option of I don't know. Whereas if I didn't have that option, I may have just selected something, and then the survey is not getting good information. I apologize. I advanced that too quickly. So now we'll talk about a focus group. A focus group is a problem-focused qualitative research technique used to collect data or validate existing data. A group interview typically involving 6 to 10 participants. An interactive facilitated group discussion typically lasting from 1 to 2 hours. So you want to keep your focus group relatively small and relatively short, and you want to really select the people for the focus group who you think you can get a lot of information with the topic that you're seeking information on. It's really important to pick those participants in a way that you think you'll get the best information. And also you want to have someone facilitate the focus group that has some experience with that. I found it is it's a very good skill. We just conducted a couple focus groups and we had a facilitator. He was amazing, and he was able to really elicit some additional information from participants, and he was very warm, just had a great rapport with the participants. So it went really well. And again, a focus group is used when you don't, those gold standard data sources, those secondary data sources aren't existing and you need to collect more information. And then there's also key informant interviews. And this is to obtain information from community experts and leaders. And you want to obtain in-depth answers or have open-ended discussions and obtain candid answers. Some respondents may be hesitant in group settings. So for a key informant interview, you really want to select people who have knowledge about the subject. It's not just interviewing anyone. You really want someone who is knowledgeable about the subject. And also this person may or may not want to participate in a focus group. Also, you may want, you may not want them to, their voice to be drowned out in a focus group. So you want to get a key informant interview. Another way to collect primary data, notes, journals, logs, diaries, photographs. And these are all valid ways of collecting information and these qualitative information. One of the things that I've seen in a focus group, well, focus groups are usually recorded. And one of the things that I've seen is it's important to have someone in the focus group actually taking notes, because sometimes verbally you'll hear someone saying something, but then you'll see someone that may be disagreeing but not vocalize that. So it's important to keep notes of those things. And then later you may be asked some more, probing questions. You may notate that in your notes, may use that for a survey later on. It's just really important. Photographs are also good, and journals, logs, and diaries as well. So now that you have data, let's talk about analyzing and interpreting those data. This is the fun part. You've done all the work. Now you get to have fun with your data and analyze it. So, excuse me. Let me go back. When we think of data, we think of things like magnitude, like how big is the problem? And the number of people that are impacted, the percent of population impacted, the rate of the population impacted. And I hope you recall from earlier, we talked about numbers versus rates. And I'm going to get into that on the next slide and show you how important that is. So for simplicity, this is prescription, it's old data, but it's simple data, or it's simple to see. It's mortality data, prescription drug opioid data for all races for 2006 to 2010. So I'll talk about that in the naloxone pilot project. when I talk about these data. If you look at the map on the left, what you see is, look down in the southeast corner, you see a red spot. And the map on the left represents age-adjusted death rates per 100,000. Now the map on the right, the same data, it's just reported in numbers, in total numbers. So when we were doing the pilot project for naloxone, we had to have a work group and we had to discuss where we were going to pilot this. And so you see in the southeast, the rate is very, very high. And if you look at the number in the southeast, if you look at the map on the right, that number says 10 to 30. So that means there were 10 to 30 deaths. Now, if you look at another county, the rate, it's in orange. It's not in red, but if you look at the number for it, it's up in the northeast. I don't want to name counties. It had 510 to 511 deaths. And so when you're looking at piloting a program, in the southeast corner, the number of deaths were anywhere from 10 to 30. So that when we're looking at arming first responders with naloxone, they may not have as many opportunities to administer that naloxone. And we really needed those data so that we could justify this program. We were going to evaluate it, and then hopefully the evaluation was going to show it was successful where it could be expanded. So for this particular project, what we did is we went with the numbers instead of the rate of overdose. And by looking at those numbers, we had more opportunities for a naloxone save. We were able to evaluate it, and eventually the program went statewide. Now, if I'm that county in the southeast of Oklahoma and I see my rate is that high from opioid overdose mentalities, then I know, wow, this might be a problem I need to look at. And so I would look at it relative to other problems in my area. Am I having this problem with alcohol? What's going on in my county? How does this compare to, I don't know, it depends on if it's a mental health issue or you're evaluating or you're doing a needs assessment on a physical disease. How do cardiovascular diseases compare to this? But for mental health, I would look at this, and substance abuse, I would look at this, compare it to things like alcohol, other types of drugs, maybe smoking, and see, wow, are we really, well, we are having a problem with opioids, but are we having a problem with other things? So I would look at how to target my resources. But again, if you're just looking at overall the state and where to conduct a pilot program, then I would go with the numbers, because if we would have targeted that program in Southeast, we may not have been able to administer naloxone because we may not have been able to find the person that overdosed in order to have a save opportunity. So here's another example of magnitude. So say I do a survey and I get 22% of adults reported that they're binge drinking. That's an insight to what's happening in my community. And I can look at that alongside other indicators for alcohol as well. I can also see how it compares to issues like opioid use. I want to emphasize here, you see DWIRS. You see it's reported as a rate, and you see the number divided by a population. And that's why I said that rates are dependent on population. And then you usually divide that number by, say, 100,000. Now, it's extremely important that you multiply that number, or I mean, you may not be doing that. You may just be looking at these numbers. Notice what that multiplier was, what your denominator is, and then what you're multiplying it by. Because what I've seen this on a project many years ago when I was looking at SID, sudden infant death syndrome. A lot of the publications that were put out would sometimes be X number of deaths per 1,000 population. Then I would see it somewhere else say X number of deaths per 10,000 population, and it'd be the same number, or X number of deaths per 100,000 population. And it was always the same number, but it was over a different population size. And when I investigated further, I found that they were actually errors. And so you see that 495, well, actually the 1,192.2 per 100,000 is a very different number than 1,192 per 10,000 population. So it's important just to notice the rate, what they're multiplying that by. Most of the time I've found for mortality, if you're looking at mortality data, it's usually by 100,000. If you look at crime data, they may have a different number they multiply it by. Birth data usually has a different number multiplied by rare events. So it's just kind of, you just kind of need to look at what that industry standard is for that indicator. So another thing you can do when you're measuring magnitudes is you can do comparisons and a rate or percentage ratio. And those can be done, like I said, either with a percentage or with a rate. And so you look at things like, how does your community compare to others? How does it compare to the state? Or how does the state compare to the nation? To get this, you divide your community rate by the other community rate that you're comparing. You can either do it, like I said, with a rate or percentage, but don't do it with numbers. Only rates and percentages. So a ratio of 1.0 indicates the community rate is the same. Less than 1 indicates your rate is lower, and greater than 1 indicates your rate is higher. And we're going to look at that on the next slide. So, like I said, you don't want to use the number because the number is not equivalent. You want to take a rate or percentage. And so say here, you look at your community and you look at the state and you get, these are rates, and you get a rate ratio of 1.16. That means your community is a little higher than the state. And the same with the DWIRS. They took the rates, then you divided your community by the state and you get a rate ratio of 1.72. The important thing I think to note here, and this is something I saw that some people don't consider when you're doing a needs, say you're doing a needs assessment and you're looking at a bunch of different substances. Say you get your alcohol is, you have these ratios here, but say for meth, your community is 6.2. If you take the ratio of your community compared to the state, that's a lot different than 1.72. They're both higher, but meth is way higher. So you want to take the difference of that into consideration. How much higher is it than the state? Is it a little bit higher? Is it a lot higher? Or it may be lower. Is it a little bit lower or is it a lot lower? So another thing we look at is severity. And magnitude and severity can be confusing to distinguish. And I don't even think you need to think about, I mean, you can think about distinguishing them. It's just as long as you're looking at all these things I'm going to tell you that can represent or you don't need to look at all of them, but as long as you consider these things that represent magnitude and severity. So I think the best way to distinguish them is by example. We talked about magnitudes and ways to measure. And so now we'll talk about severity. And severity, when we measured magnitude, we talked about things like mortality. Severity, we can talk about morbidity. Mortality is death, and morbidity is the suffering from disease. So how bad is that suffering? So to look at that, we look at things like years of potential life loss due to the disease, the economic impact of the disease, and the direct impact on others. So you can see some of these things can be a little hard to measure, but there are ways to measure them, and there are tools for that. Another thing that we can also look at is trends over time. So when we look at time trends over time, you want to have a lot of time points. You remember when I talked about those gold standard data? I told you this was all kind of interrelate. I said, you want to have something that has like 3 to 5 data points, meaning time data points. They can, sometimes surveys are administered every 2 years. So you want to have a 2-year point, a 2-year point, a 2-year point, 3 to 5 of those, or sometimes they're measured every year. So you want to have 3 to 5 years worth of data. The thing with time trends, usually they'll kind of go up and down smoothly. Every now and then you'll see some jolting, and that's usually due to an artifact, and it will usually start to smooth out again. However, if you're seeing a lot of jolting in your data, which I found with some local data that I was analyzing, I found there were a lot of ups and very sharp increases and decreases in the local data. And it made me think that maybe something else was going on. And I looked at the sampling, and what was happening is there just wasn't a lot of responses. The response rate was kind of changing over time and wasn't very stable, and it actually had low response rates. So that can be one of the reasons that your time trends look a little abnormal. So I'll show you this example. This is a smooth time trend. This is what time trends usually either gradually go up, gradually go down, kind of stay the same. Like I said, you don't see a lot of jolting up and down. And another thing to consider if you're looking at data, time data, for example, this is one of the things that I look at. Sometimes you will see two estimates, like here. Let's see, if we look at these two different data points, it's important to consider confidence intervals in all data that you see, like survey data. If you're trying to look at if something is increasing or decreasing, higher or lower, you look at something that's called confidence intervals. And I don't want to get into confidence intervals, but just know that we're here to help you with that, because if confidence intervals overlap, sometimes the number may not be statistically significant. The difference in the numbers may not be statistically significant. So when you see time trends, when you see estimates from surveys, just keep that in mind. So let's talk about another way that we look at severity, and that's economic impact. Now, this can be difficult, and I'd say it's definitely best to consult existing literature. I've done one of these a few years ago, and it was very interesting because there was existing literature, but that literature had built on another existing literature, which built on another existing literature. So you put all these different indicators into an economic model, and they keep kind of getting better information. And so definitely consult the literature. But I will say there are a couple places like SAMHSA and the Pacific Institute of Research and Evaluation that have done some economic impact. And at one point you could used to put in your community and it would give you an economic impact statement. So that was very helpful. And they also don't have to be, an economic impact study you don't have to do a whole study to make your point. As I'm going to show you in the next slide, you can just take a few things, a few indicators, and they can really, really make an impact and make your point. So I'm going to show you, I borrowed this slide from Dare Casa, and I love this slide because what it shows is, it shows on the left, what they've done is they've calculated cab fares from different geographic points in their community. And they averaged all those different cab fares, and it came to about $35. And then they took the typical cost of a first-time DWI, and they averaged those out. And so you can see on the left, $35 versus $10,000, and then they put their Be Smart, Call a Cab. So I think that's a really good way. Again, they didn't have to do this whole economic impact of how, an example of a whole economic impact study would be like how much it costs in tax revenue, how much it costs in your job loss, your income losses, revenue to the state, the cost of society on law enforcement, prisons, things like that. So
right.
This was
about the tall grays.
Does someone have a question? Okay. Sorry, I heard someone, I thought they might have a question. So this was just a really good example of you don't have to do a whole economic impact study to make a really good point for your community. So now I will go to our third quiz. And okay, the first question, and moderators, if you will help me with this, I'd really appreciate it. As an indicator, such as prescription opioid overdoses, you can have a relatively high rate, but also have a relatively low, if you'll remember that map, can have a high rate, but the other thing can be low. Oh, I didn't even open chat. Let's see. Percentage, that's close. Ratio, that's something that we did when we looked at the rates and the percentages, we made a ratio. So if you remember on the map, on the left, it showed rate versus number. Sandra, that's right. Okay, Sandra. Yeah, so you can have, because rates are dependent, let me make sure this isn't a question. Okay, it's not a question. Because rates are dependent on your population. If you have a small population, your number can be relatively low for it to be a high rate. But if you have a large population and a seemingly large number, it can have a relatively low rate, because rates, you take your number and then you divide it by the population and then you multiply it either by 1,000, 10,000, or 100,000. So rates are dependent on population. So Sandra, that is right. Okay, so we talked about this when we talked about gold standard surveys, and when we also just talked about it again. And it can be, you need to have a lot of data points in order for this type of trend, for you to have enough data points to establish this type of trend or to look at this type of trend. Oh, someone said time. Yep, time trend. Yeah, Sandra, you got it right. Yeah, for a time trend, you want to have a good amount of data points so that you can measure the trend over time. Okay, and I'll ask one more question. This type of impact looks at the financial costs of the substance. We're talking about severity. Yep, Tiffany. Okay, so it looks like, moderators, do you have Sandra?
Yes, we do.
Sandra, okay. Sandra, thank you very much. So now what I'll do is if any, we'll start with questions, and I wanted to allow you enough time so that you could fill out your evaluation and enough time for questions. And I appreciate you all sticking through this. I know there are a couple of bumps, along the way with the presentation, but I appreciate you. And does anyone have any questions?
If you all know how to use the raise hand feature, we can utilize that during this time, and then we'll just call on you. And so it can go a little bit smoother if you do have questions. The survey link has been posted in the chat as well. So we hope that you will fill that out. I'll send it once more if we have some questions come up in the chat as well.
No questions? Well, I want you to know that it's my job at Southern Plains to actually offer free of charge technical assistance if you're thinking about developing a survey, if you need help analyzing data, if you need help with your needs assessment. I'm an epidemiologist, and we have several epidemiologists that are always here to help. You have my email address. I can send you a link to our technical assistance form. We're here to help you. Okay, thank you. We're here to help you. So thank you all for attending this. I hope you have a wonderful rest of the training and learn a lot of different need information. Thank you.
If you would like to maybe start a conversation or anything with Jamie at this time, we have about 30 minutes left of this reserved session. If you guys do just want to say thanks or unmute yourself and, like I said, have conversation, that's totally okay here as well.
I see Tracy asked if you can get a copy of the PowerPoint. And Be More asked for a copy of the PowerPoint. So moderators, do we have a list of attendees with their email so that I can send a copy?
We can access that on the registration side, but if you all did want to put your email into the chat, I can write those down as well if you want a copy of the PowerPoint.
Thank you.